Okay, my name is Mahmud Mozaffari. I'm from Georgia Regents University in Augusta, Georgia. My background is in basic science research, fields of diabetes mellitus and cardiovascular. I'm also a dentist, and therefore I have that background as a clinician as well. I have been interested in being involved in EMPA for several years now. In fact, since its inception, when Dr. Glubnechaya introduced me to the philosophy of EMPA, which, put it simply, states that we need to have a paradigm shift in healthcare from reactive healthcare to preventive and predictive healthcare. I found the philosophy to be very novel, very interesting, and that's the reason I became involved with EMPA's efforts. My initial charge was to help establish the journal for EMPA, whereby we can publish articles, particularly in the fields of diabetes mellitus, as it relates to predictive, preventive, and personalized medicine. The first journal volume came out actually in the spring of 2010. Subsequent to that, we had a very successful first World Congress of EMPA, which was held in September of 2011 in Bonn, Germany. At the conclusion of that meeting, one of the planned activities was to start a book series in collaboration with Springer as our publisher. And in fact, that book that is dedicated to PPM in diabetes was published in the spring of 2013. This book is composed of 11 chapters that brings about the message of the global burden of diabetes, relying on emerging information in the field. It deals with the pathophysiology of the disease process, and it importantly deals with the management of the diabetic complications, particularly from the viewpoint of predictive, preventive, and personalized medicine. In this Congress, for the first time, given my background and interest in dentistry, we have also for the first time introduced a session which was dedicated to oral diseases and dentistry. That session was held this morning. We had speakers from multiple countries, over a dozen presentations, and therefore I think in combination with our efforts in the fields of diabetes now has expanded to involve dentistry, and our other colleagues in EMPA are also addressing other major diseases such as cardiovascular disease, neurodegenerative diseases, and cancer. I think EMPA is at the forefront of efforts that are dedicated to once again having that paradigm shift in healthcare from reactive to predictive, preventive, because ultimately not only the cost of the healthcare should go down, but also the quality, most importantly, the quality of healthcare delivery to patients will be improved if we were to achieve the noble goals of EMPA. EMPA has its own website that the address of that will appear at the bottom of this clip. For anyone interested, they can get more information about EMPA and its activities. Thank you.